4 months after suffering a pregnancy loss, Chrissy Teigen is getting surgery to treat endometriosis. Endometriosis is a condition that causes uterine-like tissue to grow outside of the uterus, resulting in painful period cramps and spotting, among other symptoms. "I have surgery for endometriosis. The period feeling this month is exactly like baby kicks," Teigen wrote in a tweet yesterday. Teigen also shared that her late son Jack would have been born this week, so the kick-like cramps reminded her of him. She miscarried at the end of September after being hospitalized for excessive bleeding. "I'll pretend it's him saying hi, it never stops," Teigen captioned a video of her stomach moving, apparently due to cramps. Severe endometriosis cramps typically feel like tugging, twisting, or pulling, although every patient's description of their pain is subjective, Jessica Shepard, MD, an OB-GYN in Texas, told Insider. Endometriosis affects 1 out of every 10 women of reproductive age, or roughly 176 million women worldwide. It's most commonly diagnosed in women in their 30s and 40s. Teigen is 35. "It's likely that endometriosis is underdiagnosed," Shepard said. "It can take several years to diagnose endometriosis, and it can only be confirmed with surgery, since its symptoms resemble gastrointestinal and bladder issues. Because it overlaps with many other symptoms from other organ disorders and conditions, it's not the easiest to diagnose," Shepard said. "Surgery is the gold standard for how you diagnose it, because you can actually see the lesions and get a visual on how it looks in the pelvis. The growth of endometrial tissue can lead to painful inflammation, scarring, and adhesions that bind the pelvic organs together. It's also associated with fertility problems and miscarriage. Endometriosis is a chronic disorder that can't be cured with a single treatment," Arnold Advincula, MD, Chief of Gynecology at NewYork-Presbyterian, Columbia University Irving Medical Center, previously told Insider. That being said, people with endometriosis can manage their pain with non-steroidal anti-inflammatory drugs, NSAIDs, like naproxen or ibuprofen, and try to minimize tissue growth with hormonal medications like Lupron. Hormonal intrauterine devices (IUDs), such as Mirena, can also be inserted to control tissue growth, inflammation, and bleeding. If someone develops adhesions due to endometriosis, they might need surgery to remove the scar tissue. Shepard told Insider it's possible that Teigen's surgery could be diagnostic, or her surgeons could be resolving an issue observed in previous imaging.